What are the usual ongoing tests run by doctors for patients on a hormone therapy protocol?
Right. Yes, that question.
So I think the question is sort of really asking, how do we assess how the disease is being controlled, and how do we assess for side effects? And those are two separate things, and we're assessing both of those things at all times. In terms of tests that we would use to figure out how the disease is being controlled, they're not necessarily different for a hormonal therapy versus different types of therapy, but it's most often some sort of scans, and there's not one type of scan that is necessarily preferred. It depends on the individual situation, but examples of types of scans that we would consider would be CAT scans or bone scans or PET scans, sometimes MRI scans. And there are different choices. Oftentimes, it's easiest as a physician, I find, that if we have picked one type of scan, that we get the same type of scan the next time, because it's easier to compare apples to apples than apples to oranges. The other types of tests that we are often monitoring would be blood tests. For example, if it's a medication that causes low blood counts, we'll be monitoring blood counts. There are some situations that we consider getting tumor markers, although it is not required in all situations. So those would be examples of the common types of tests that we use to monitor.